Hello everyone, my name is Dr. Ahmed Katsha. I'm going to be your professor and learning coach for this Anatomy and Physiology 2 at RVCC. Unfortunately, we could not meet today, but I will go in this video and explain the basics of the course and the way I set it up. So we will be all on the same page, and next week we'll jump immediately into the materials. So the first thing I would like to go through is the syllabus. As you know, you have access to the syllabus from Canvas, and there are a few things I would like you to bring your attention to. The first one is the point distribution. So as you can see, we have exams, we have final exam, lecture quizzes, class homework, participation, lab quizzes, lab exams, lab quizzes, and lab reports. And in fact, for those collectively, of course, they are 100% of your grade, but out of this 100%, there are 75% of the grade. If this is your 100% grade, 75 of them is coming from the exams. And for those exams, what we will have 4 lecture exams. Those will worth 40%. You will have 2 lab exams. Those are 20%. And we will have 1 final. That is 15%. That is, again, 75% of your grade is coming from the exams, which means that the bulk of the grade is coming from the exams. And that's where you need to pay attention. If you hurt yourself in the exams, it's very unlikely that you will get a good grade, even if you are doing perfectly with the other 25%, which we will talk about. But the point is, you have to focus on the exams. All of the assignments that you will go through in this course are tailored toward the exams, and it should help you prepare for the exams. I give plenty of study materials, plenty of practice exams and practice quizzes to help in preparation for the exams. But by the end of the day, you are taking the exam by yourself. Nobody's going to help you. And that is where you need to pay attention. Now, if I want to compare AB1 and AB2, I will say AB2 is less dependent on memorization. We will have few items to remember or to memorize in AB2. In AB1, there were plenty of memorization. However, in AB2, we have plenty of physiological processes. What do I mean by physiological processes? Is that if you remember in AB1, the action potential, for example, in the muscle chapter, or how the action potential is moving through the neurons. Those type of processes, we will see several of them in AB2. For many students, it will be challenging, but it's fun. You will feel you are learning new stuff rather than trying to memorize them as we did in AB1. So for now, just at least understand that we have those exams, that the bulk of the grade is coming from those exams, and you need to understand, in order to excel in those exams. Memorization by itself will not take you far in AB2. What are the other assignments that you will see in AB2? Those are the 25% of your grade. We have lab quizzes. This is around 7%. We have lab homework. This is around 5%. The lab reports. You have lecture quizzes. Those are in Canvas. Those are 5%. Then you have lecture homework. Those are the group discussion questions. Those are 4%. And you have the participation. Those are also 4%. Okay. Now, all of those, I consider them easy points. What does it mean, easy point? It means it needs minimum effort, least effort to get them. The lab quizzes plus the exams, those are not easy points. It means it needs good effort to get them. Okay? So be careful. Those will help you in the exams. Even the lab quizzes, my students know this, that they will help in the lab exams. Okay? But yet, even if you get 75% on your exams, but here you come short in those items, it means your grade will not be A. Okay? You still need at least like 15% or so to get to an A. So you need those grades. So don't take them lightly. As I said, those are easy points. The minimum effort from your side will secure them. But still, there is some effort you need to provide. The only one that I'm going to explain more is the participation. Participation, this is to encourage you to ask questions, whether in lab or in lecture. Just raise your hand and ask a question and you will get a point. Okay? That is the participation. Of course, answering question will give you also participation points. There will be also forum participation. Those are also ways to get those 4%. Many students, and sometimes good students, aiming for A, they fail here. They come short in the participation. Okay, but in essence, those are easy points. You should not miss them. So this was the point distribution of the course. Then the other thing in the syllabus is the rules of the course. There are general rules. Those are my expectation from you, that you will be prepared, be on time, disciplined, engage positively in discussion, work in group as instructed, and know the due dates, know the homeworks, know those stuff, right? If you don't know them, you will not be able to submit them on time and there will be consequences. So there are things that, and those things are, expected from you as a student. I have to put them there because always I find students don't know about them. Then we have 3 rules. The first rule is that I want you to develop critical thinking skills as if you are going to be a nurse in emergency room or intensive care unit. Nurses there, they have very sharp critical thinking. They have to make decisions that will affect patients' life. Therefore, they have to be really on top of what they know and on top of their practice. And this critical thinking is something that we can all develop. It's not something that we are born with, and I will help you to develop it. But it is a goal of this course that you will develop this critical thinking ability. And we will see scenarios, we will see situations that would require you to put several types of information or several bits of information together to make a decision, and that decision will be reflected on the patient's life. Okay, that, or the second rule in this course, that there is no stupid question. So don't be afraid to ask. And as I said earlier, you will have points. You will receive a point every time you raise your hand and ask question. It's 1 point per lecture. Okay, so you will keep asking through the semester to secure those 20 or 30 points. And rule number 3 is that I need you to learn, and I need you to understand what you are learning. Don't think of the material, I just want to, pass the exam. If you learn it, you will pass the exam. If you are just trying to pass the exam, it might work, it might not work, but definitely it will hurt you on the long run. I always have, feedback from students who took the course with me. 2 or 3 years later, they send me back saying, that the things we learned from you, we are carrying it now. And it came back to us when we are studying it in our, advanced courses. So it's really better to invest in your future now by learning the material we are taking now, because later you will be dealing with other stuff and you might not have the time or energy to go back and check what was that thing in anatomy and physiology too. Okay, so this is the time to learn those stuff. Then for the policies of the course, you are not allowed to use any types of electronics during the class or the lab unless they are related. What you are using them is related to the materials, which means checking in news, TikTok, social media apps. All of this is prohibited during the class time. It will affect you, it will affect your neighbors, it will affect the people behind you, and it will affect me. All of us will get distracted by someone who is looking through their phones, not paying attention to what's going on around them in the classroom. Attendance, especially in the lab, it's mandatory. If you miss more than 2 labs for whatever reason, you will be forced to fail the course. You will be failing the course unless there is a documented emergency. Please come talk to me if you have situations that you cannot attend. And again, especially for the lab. For the lecture, if you are missing the lecture, you are not going to lose any particular points. You will be losing the participation points. You will be losing the things that we have talked about during the lecture. In my lecture, I usually give hints on what's going to be on the exams and so on. So you will be missing all of that. In case you have missed any lab or lecture, it's your duty to know what you have missed, what are the assignments, what are the things that you need to be aware of. Okay, I'm not going to repeat them for you just because you have missed. So it's better to form a group or to have contact of other classmates, exchange your information so you can text each other or you can get those missed materials from them. You are not allowed to retake any exams unless there is a documented emergency. If you have any accommodation, please submit it to Canvas so I can accommodate you with the exam time. Questions on the exams, you'll be expecting multiple choices, true or false, fill the blank, matching. Sometimes we'll have diagrams, not drawings, just diagrams to label. Okay, and open-ended questions. You need to think of the materials in those types of questions. If you are studying a bit of information, think of it how it can be in a question of true or false, how it can be in a question of multiple choices, and so on. Lecture quizzes. Every time for each chapter there is a lecture quiz in Canvas. Sometimes there are 2 quizzes. They are already open. They don't have a due date yet, but please don't open them unless we are done with the chapter. Once you are done with the chapter, you can go ahead and take them, and I will assign them usually the Sunday following the end of the chapter. So if you are done with the chapter on Wednesday, they will be due on Sunday. If you are done with the chapter on Monday, they will be due on the following Sunday, and so on. Okay? For the homework, the lecture homework, that is the group discussion questions. If you go to the PowerPoints, there are slides that says group discussion. This is group discussion 1. In this chapter, in the special senses chapter, there are 4 groups. This is group 1, group 2 is here, group 3 is here, and then group 4 is all the way here. You need to handwrite those answers, the answers of those questions, handwrite them in a paper, then take a picture of that paper and upload it to Canvas. It doesn't have to be extensive answers. If no more than 15 minutes to 30 minutes to answer all of those questions. If you Google the answers, if you Google the question, it means you are putting too much effort into those questions. All of the answers are in the PowerPoint. There is no need to Google them. The purpose of those questions is just to force you to go through the materials before we start the chapter, so you have an idea about what we are going to talk about. Okay? Don't spend the 3 hours trying to solve them. No, 30 minutes and do it in your downtime. Okay, not your prime studying time. No, in your downtime. What do I mean? I mean that, for example, after you are coming back from work, it's maybe 6 or 7, you eat your dinner, right? You don't have the energy to study, but you want to force yourself to do something related to study. That is the time to do those group discussion questions. Don't spare them for your prime time. Use your prime time for studying for the difficult stuff. This is pure mechanical stuff, okay? That it does not require you deep mental work. It just requires you to look in the slides and find the answers. For the other things you should know about, there are the labs. I will keep the labs until we meet in the lab. There are the extra credit. I'll talk about them. But I need to talk about 2 other things I need you to be aware of. If you go to the modules, in each module, there are videos. And those videos are basically recording of myself explaining the materials you are going to see. Okay? Now, videos in average, they are between 10 to 15 minutes max. I don't think I have any video beyond that. And what I need you to do, if there is only one thing you can do through the semester, is to watch those videos before lecture. Okay? Come to the lecture and you have seen them. Not necessarily all of them. Of course, you are not going to be able to finish the entire chapter in one session. For example, the special sensory receptors. Maybe you can go watch first and second and third video for the first lecture. And then for the second lecture, you will watch 4 and 5 or the remaining. But the point is to watch those videos before coming to the lecture. If there is only one thing you need to do, if you ask me, tell me one thing I can do to be success or to have success in this course, I will say watch those videos before coming to the lecture. This is one thing I need you. I can't emphasize this enough. This is one thing you need to do. The other thing I would like you to do is this. the checklist and the pre-class quiz. Here, this is a document that contains two things or three things. Here, it contains the learning objects, then it contains terms that you need to be familiar with. Having yourself familiar with those terms by the end of the chapter, it will set you up for a good grade in the exam. Okay? Be familiar with each one of those terms. Then there are the concepts that you need to master before the exams. Okay? Those are concepts that we will cover in each chapter. Also be familiar with them. Try to familiarize yourself or master them before the exams. Then there is the pre-class quiz. In ideal world, you will take this quiz before you start watching the videos, before knowing anything about the material. Okay? And then as we progress through the chapter, you will go back and correct your answers on those quizzes. You will use them also, to practice for taking exams or quizzes while you are studying. But the idea is try to take them before the lecture and try to correct yourself as we moving through the chapter. There is no key for them. If you need to know the answer, you need to come and ask me. But the point is to be able to correct yourself about them. That's why purposely there is no key for them. Otherwise it will be pointless. Okay. The other thing I want to talk about is the extra credit. And in this course, there are 3 ways now to get extra credit. There is the service learning. This is one. The second one is my lab and mastering. And the third way is creating portfolio. This is a new thing in my courses. We'll apply it for the first time. We'll see how it goes and I will be explaining it. But let's go through them one by one. Service learning is basically you are going to volunteer in what we know as a placement center. Those could be animal shelters. Okay, could be kitchens, elderly houses, churches, schools. Each one of those placement centers has been pre-contacted. What you are going to do, you will help them in whatever they need and you will receive the 5%. By the way, all of the extra credit are 5%. Whether you are doing 1 or 2 or 3, it doesn't matter. You will only receive 5% of your final grade. For the service learning, you will need to do 15 hours per semester. So for the entire spring semester, you just need 15 hours. And again, there are the placement centers that you will contact. All of them have been pre-contacted. You will choose something that is close to your home or close to your work or close to the school. You will fit the time with your schedule and you will go maybe 1 hour, 2 hours a week, and you will do whatever they want you to do. What you will get the 5% from me. And from the school, you will get a certificate or a transcript. It's called the engagement transcript. It will be something like this. You can have this into your application for nursing school, for occupational therapy school, for whatever program you are applying. This will add weight to your application. It will add points to your application. It will make your profile distinct from the other profiles because it shows that you have been in professional setting. You have been, looking into the community, trying to help, trying to pay back. That you have open-minded, you know about the problems of the world, things like this. And usually in those programs, they will appreciate stuff like this more than, someone who is just, immersed in learning or in studying. Okay. So this is one way of doing it. It will benefit you in this course and also in the future. The other way of getting the 5% is my lab and mastering. In AB2, my lab and mastering is mandatory. I'll show you in the lab how to set it up. But if you go there are assignments named like extra credit for each chapter. See here, for example, the fluid extra credit, urinary system extra credit, digestive extra credit. So basically those are questions, multiple choices questions that you will be studying, okay, answering them and preparing, and this will prepare you for the exam or, to help you and better understand the material. And at the same time, you will get 5% extra credit by just doing them. Now for those, be careful because they have due dates. Okay, so this one will be due by January 28th. I usually can extend them if we are not done with the chapter by then. So that is fine. But once we set a due date and the due date is gone, you are not allowed to retake them. Okay, so please plan. If you want to do them, plan ahead. I always, at the end of each semester, I have students, they want to do all of them. Okay, so I don't accept that. You will only be doing the one that they are open. Okay, so in order not to miss out on those extra credit, commit yourself to do them. Okay, because they will help you and you will need them by the end of the course. The third way is creating portfolio. And for the portfolio, as I said, this is something new. Basically, you are going to create a portfolio of your learning. You will have stuff there that would reflect your progress or your learning journey in this course and in other courses. For me now, as I said, this is the first time I'm having it, and I will encourage nursing students or students who want to be nurses and aiming to apply to the nursing program at RVCC to consider having this option as their extra credit. Because in nursing, there are some courses that would carry on with the portfolios. Basically, again, you would be documenting your journey through learning. So it will be nice. It will show a nice transition from AB2 to maybe microbiology. I'm not sure if microbiology will have it, but there are other courses in nursing that would help you in putting things in your portfolio. When you are applying for a job or something, you can use this in your application that to show you or to document your progress of learning. Anyway, more details about this, someone would come and explain it to us, and they can answer your questions maybe in the second or the third lab. That is when we will talk about it in more details. But at least have it on your radar. Maybe consider doing it if it appeals to you, or if you have done it in other courses, and it will come along with the other experiences you have. But for at least for now, for the extra credit, those are the 3 ways of getting the 5%. And please consider doing one of them at least. So that's it for the course setup, for the extra credit, for the syllabus. Let me know if you have any question, and I'll see you next week.